Let's get into our first topic. Is the NHS app unfair on the elderly? The government is overhauling the health service and making the app its digital front door, so to speak. Now, the app will allow you to book appointments and self-refer for certain services. It will also use AI to give you instant advice and direct you to the best place for healthcare. The Health Secretary said that he's bringing our health service into the 21st century. But there have been some campaigners who've been concerned. Silver Voices, for example, are saying that older people could be excluded from accessing timely healthcare. Esther, what do you make of this idea that it's been dubbed as a doctor in your pocket?
I don't have a problem with it. It depends on how it's done. I don't want a situation where the NHS is doing everything in its power to make sure you don't actually see a doctor. And obviously, if the app is trying to basically triage people, well, if you answer a question in the wrong way, or you don't have enough information, or you don't remember, it could send you down the wrong path. So we have to be careful. I don't think it's necessarily just the elderly that could struggle with this, although they are a group that we have to take particular concern for, because many may not have smartphones, they may not feel comfortable with this, and there's an importance of the human touch, for example, that I think is invaluable in healthcare. So it really depends on how this is rolled out. I don't think this should be in isolation, and it's obviously not. That's not West Streeting's plan. There are other measures as well. But fundamentally, we do need more doctors and nurses and healthcare workers. We do need more frontline staff. We have a growing population. We have a growing elderly population as well. And that should obviously be the focus. But we always complain about our public services being behind the times. You know, a lot of the equipment, the technological equipment that doctors use are like really outdated. So I don't have a problem with bringing it into the 21st century to speak, but we have to be careful with how it's done.
Zack, what do you think? I mean, this is part of the government's 10-year big plan of restructuring, rebuilding the NHS, if you like, and the app seems to be that sort of big headline announcement that you're going to be doing everything through this app. Is it a good idea?
I think the headline announcement people wanted to see was more doctors, more nurses, more beds. Just yesterday, I was at Epsom Hospital, where cleaners, porters are ready to strike with United Voices of the World, because the NHS is saying that they can't even afford to pay these migrant workers NHS pay. That's how bad these things are right now. So the idea that an app, which will digitally exclude millions of people in this country who find it difficult to use technology, or the poorest people who don't even have a phone, that doesn't seem like the sensible approach here. The sensible approach would be the human touch, to fund our National Health Service properly and make sure that everyone can access a GP when they need it. And none of those things are out of wit of man, they just require funding. Okay,
let me just try and play devil's advocate here and just make the point that if you're using the app, you are streamlining services. So if I can, instead of queuing for 2 hours
at 8 a.m., which you have to, at the moment, that's the scramble.
Yeah.
You have to get up at 8 a.m. and
8 a.m. or even when you call. So there's, a couple of people in the backroom staff of the surgery taking call after call after call. If you free them all up and you can do it via the app, aren't those people then free to have a more bespoke, more careful care of the elderly in the community? Do you see what I mean? That at the moment, by using things like the apps and connecting everybody and everything, you're actually freeing up time and personnel to look after those people who perhaps don't have access to that app.
There's definitely a space for technology. And if I trusted this government, or trusted this government to do the right thing.
You just don't trust them to do the right thing?
Well, I think it's important to know that the Every Doctor campaign have shown that MPs have taken £2.3 million in donations from private healthcare companies. Right. So then when they're looking to use public money to funnel into private companies for things like artificial intelligence, when they're not even getting the basics right, I think it's right to ask them questions.
I mean, far be it from me to defend this government, but because there's a lot to be upset
about. Are you
going
to?
Well, not this government, but I will say that West Streeting has been a shining light in what is looking like a dark cave of a government, because he's made all the right noises about the NHS. He's made, he's talked about increasing the kind of, or making use of the excess capacity in the NHS, freeing up weekend appointments, for example, bringing more care in the community, talking about obviously increasing the number of frontline staff and beds and all of that. So this is why I say it depends on how it's done. If there's anyone in this government that I have to trust on anything, he's probably the most likely, because I feel like he's made all the right noises on it. Now, it depends on how it's rolled out. Of course, we still need more physical staff and physical resources, but for many departments in this country and many public services, technology is really far behind. And so I don't really see a problem with this kind of approach, so far as it's done well.
Is there an ethical question, Zack, between you're quite rightly pointing out, and I'm sure quite a lot of people watching will say, well, actually, look, I don't really use my phone for banking. I use it to contact friends and relatives, but I don't use it to do anything else. Is there an ethical question or a moral question in, this is going to leave some people behind? Maybe some people watching will be worried that if I have to use an app to get an appointment with my doctor, what does that mean for me? How am I going to get my care? But is there always that decision of, do we move ahead with something like this that is important because it's going to connect all the aspects of the NHS and streamline the NHS and save money? And at the same time, we have to make that conscious decision to leave some people behind.
We do need to connect all the aspects of the NHS, but things like adult social care, for instance. 6 months ago, Prime Minister and Wes Streeting said they were going to have a cross-party agreement on social care. It's been 6 months and they haven't had a single meeting. So again, I think in terms of moving the NHS forward, yes, we need to do that. But let's get the basics right. Let's look at harm reduction, prevention. Let's look at making sure that people can get the services they need.
Okay.
New technology, new shiny headlines. I don't think that's the answer here.
All right, let's find out what people are saying at home. Megan is in Sussex. Megan, welcome to the show. Do you worry that some people are going to be left behind? Is this kind of app unfair on the elderly?
Yes, I do think it's unfair. I mean, when you get older, you don't have 20/20 eyesight. I mean, there is, and I'm sure you've heard of glaucoma. You don't know what illnesses they've had. You don't know what medication they've been on. They could have a permanent tremor. I mean, I was a nurse for over 30 years, and I know every pill you pop in your mouth has got side effects, so I'm pretty anti-pills. But I just think it's totally unfair for the elderly. I mean, internet has tripled since we've had, type 2 diabetes has tripled since we've had internet.
But Megan, it's a difficult decision, because you're absolutely right. There are some people out there who are not going to benefit from this and from some of these suggestions. But is there not an argument that by streamlining some aspects of the NHS, because everybody, I mean, Zack mentioned it, we need more doctors, we need more nurses, we need more money. We keep doing the same thing, but things are getting worse.
Yeah, but there's no support for these elderly people. A lot of them, we've still got quite a few that fought for this country. And, I mean, they can't even get a reinstatement. And I think this, they're in government we've got, walk into Parliament, House of Commons, and they get £300 for walking in there. I think they all get free.
House of Lords, you're talking about?
House of Lords, House of Commons. I mean, an MP resigned just over 2 years ago because he was watching porn in the House of Commons. So it must be boring.
Right, okay.
But
Megan,
there, and she needs to come back. She's a brilliant woman. She's on my bucket list.
Okay. Well, Megan, thank you. Thanks for kicking us off. Lisa's in Hampshire. Lisa, welcome to the show. Is this technological move forward, getting that app, the doctor in your pocket, do you think it's unfair on the elderly?
It's not just the elderly, it's also the young, vulnerable people who are chronically sick and disabled. I have been for more than 30 years. I'm not classed as elderly. I am in my 50s, but I'm not classed as elderly, so they are affected. People who are not online, I haven't been online for over 15 years, so it affects me. I have no one around me who is online either. I've been let down by so many of the organisations, not to mention the confidentiality issues surrounding all this computerised keeping of records. I am very strict on that. I've been an opt-out of sharing my records for about 2 decades, and it is in writing and on the screen at my GP surgery. There is no sharing of my records. I have never shared them.
Lisa, if you don't mind my asking, you don't have to answer this if you don't want to. How do you do your banking at the moment?
I don't actually manage to do it because I've been housebound since the middle of last year, thanks to an infection and everything. And
so, do you have someone doing it for you?
No. No one's doing any banking for me. I'm not getting any help at all. My situation is a very long story, and it's a very horrible situation to be in. I wouldn't wish this on my worst enemy.
I'm sorry to hear that, Lisa.
Yeah, social services have let me down horrifically over the last 10 years or so. And the DWP have really messed me about, and for years they didn't pay me. Eventually, after years of tribunals, they then paid me and admitted they had made mistakes. And I'm still waiting for my formal apology.
I hope you get that apology, and thank you so much for picking up the phone and speaking to us. And I'm sorry you're going through that, but I'm glad we're able to keep you company and that you're able to get in touch with us and tell us your story. And that's the key, isn't it? That we have. I remember. I was talking about it to someone only yesterday. I remember Boris Johnson winning that, at the time, landslide election in 2019 off the back of Brexit. But I do remember what he said on the steps of Downing Street. He said they were going to fix social care. And whether you liked Boris Johnson or not, I think the whole country thought, yes, that is what we need to do. Now, you could go on and say COVID happened and threw a spanner in the works, but we're still, even with all these announcements, people like Lisa and many people there who are not going to be able to use the app, well, that's what social care is for. That's what you have people coming to your house and helping you, booking those appointments, doing your banking, looking after you. And yet we're nowhere with social care.
I mean, we have to remember this hasn't been rolled out. And of course, there will be exceptions for people that don't have smartphones, who can't use them, or people that need a certain kind of care. But I do think if we're talking about sections of society, for younger people, for example, this is a very easy way for them to feel like they can access their GP. For example, for someone like in my age group, for example, it's very hard to get a GP appointment. I call and they're like, oh, you're young and healthy. And I just get pushed to the back of the queue. Seriously, and I've had friends who needed surgery and they have this impression that, oh, actually they're young and healthy, so they almost feel bad, like they're taking up a space or taking up a bed. And I don't think we should have this approach that the NHS is just for certain types of people. This is just one solution, and I think, and I expect to be a vast array of solutions.
Okay, let's get back to your call. Sandra is in Merseyside. Sandra, welcome to the show. Do you think this kind of app is going to be unfair on the elderly?
No, I'm 80. I've been using this app for 5 years.
Great.
5 years. And the only thing you can't do is book an appointment. You still have to ring.
That's true.
I can check all my results, everything. But
that's true. That's going to change soon. That's why they're trying to do that. You're going to be able to
That would be brilliant.
So you would welcome that?
Yes, very much.
Great.
I think people should be allowed to teach other people how to use it.
Yeah.
Because it isn't hard.
It's not hard.
It really isn't hard, no. It's simple.
Who taught you how to use it, Sandra?
Myself, really. I think I've been doing it for years now. I'm disabled. I buy all my clothes online. I do everything online. But the app, the NHS app, I can check all my results from my blood tests and everything. It's brilliant.
Great. Well, we've got an endorsement from Sandra. Thank you, Sandra. Let's speak to Jane, who's in Kent. Jane, welcome to the show. Have you used the app? Do you think it's a good idea?
No. I'm 60, just turned 60. My phone doesn't support. I've got a smartphone. Yeah. I'm an idiot using a smartphone.
We all are, Jane. We all are. Yeah.
Yeah. But my phone, I've got a 2015 phone. I can't afford to buy a new phone.
Yeah.
And all these apps that they come out with, I mean, even, like the shopping ones, like one that begins with an L, I can't get that on my phone because my phone doesn't support it.
Have you tried getting the NHS app on your phone?
Yes, and my phone, the Android version, isn't enough for it.
It just said
you've
no,
got to have Android 8 or over.
Yeah, well,
and mine is...
Jane, thank you. Thanks for getting in touch. I mean, that's going to be the problem for people. But as Esther pointed out, you're not only going to be able to book an appointment via the NHS app, surely. You're going to be able to call up. Yeah. But again, Zack, this is where community social care can step in. We know that's the biggest expenditure for local councils is social care, particularly looking after elderly and young kids that have children that have got issues. And yet, if West Streeting doesn't address social care, all these people we've heard from there, apart from Sandra, who can use the app happily, they're going to struggle.
Well, it's great to hear that Sandra's using it happily, but I think there's nothing more shameful in this country than how this government have treated disabled people and disabled communities. We've seen this through the recent votes that have happened in Parliament, but also the amount of people in this country suffering with things like long COVID, and we just rarely hear about it in public spaces. I think it's good that some people can get over these barriers, but ultimately we should have a social model of disability, which is where everything is accessible to everyone and it's designed in that way. But designing things to be inaccessible to people and then expecting them to make exceptions when they're already suffering with long-term health conditions and various barriers in life just seems performatively cruel. Well, not even performatively, it just seems cruel.
Okay. Well, look, thank you, Jane. Thank you all for your calls on that. It's time for us to move on. Don't forget, later, we're going to be asking if it's okay for kids to be vegan. Would you put your children on a plant-based diet? Let me know. Maybe you already have. Let us know your experience, how you got on. But now I want your calls on this.